Hello and welcome. Today we're diving into a common condition that can affect vision after cataract surgery: posterior capsular opacification, or PCO. Often referred to as a secondary cataract, PCO is a clouding of the lens capsule, the membrane that holds the artificial lens implant in place. Let's explore what causes it, how it's diagnosed, and what can be done about it. So, what causes PCO? Remember, during cataract surgery, the cloudy natural lens is removed, but the thin, clear membrane that holds it, the posterior capsule, is left intact to support the new artificial lens. PCO occurs when residual lens epithelial cells, which remain after the surgery, migrate and proliferate on this posterior capsule. These cells can change into either fibrotic or pearl-like cells, resulting in clouding or wrinkles on the capsule surface. In essence, it's not a new cataract forming, but rather a change in the capsule behind the artificial lens. Let's delve into the pathophysiology. As mentioned, the remaining lens epithelial cells play a crucial role. These cells, intended for lens fiber production in the original natural lens, can undergo a process called epithelial mesenchymal transition, or EMT. This transformation allows them to migrate and proliferate. Some transform into fibroblast-like cells which produce collagen, leading to fibrosis or thickening of the capsule. Others form bladder-like structures, referred to as L-Schnig pearls, which cause light scattering and blurred vision. The exact mechanism triggering this cellular behavior isn't fully understood, but factors like individual patient biology, the type of intraocular lens used, and surgical technique can contribute. PCO is quite common after cataract surgery. Studies estimate that it affects anywhere from 5% to 50% of patients within 5 years of their initial cataract removal. The rate can vary based on the type of intraocular lens implanted, surgical techniques used, and patient-specific factors such as age, presence of diabetes, or a history of uveitis. While PCO can occur at any age after cataract surgery, it's observed more frequently in younger individuals and those with certain underlying health conditions. The primary symptom of PCO is a gradual blurring or haziness of vision, similar to the initial symptoms of a cataract. Patients may experience glare, halo surround lights, and difficulty seeing in bright light. Some might also notice a decrease in contrast sensitivity. It's important to note that PCO doesn't cause pain, redness, or other signs of inflammation. If you experience any of these symptoms after cataract surgery, it is essential to consult your ophthalmologist to rule out other possible eye conditions. Diagnosis of PCO is usually straightforward. Your ophthalmologist will perform a comprehensive eye examination, including a visual acuity test to assess your sharpness of vision. A slit lamp examination, using a microscope with a bright light, allows the doctor to carefully examine the posterior capsule and identify any opacification or clouding. In some cases, additional imaging tests, such as optical coherence tomography or OCT, may be used to provide a more detailed view of the capsule and rule out other potential issues. While PCO doesn't have distinct types in the same way that cataracts do, the appearance of the opacification can vary. As we mentioned, there are fibrotic and pearl-like forms. Fibrotic PCO appears as a diffuse, sheet-like clouding, whereas pearl-like PCO presents as clusters of small, bubble-like structures. The dominant form can influence the symptoms and the need for treatment. The good news is that PCO is typically easy to treat with a quick and painless procedure called a wide laser capsulotomy. During this procedure, a laser is used to create a small opening in the center of the clouded posterior capsule, allowing light to pass through and restoring clear vision. The procedure is performed in the doctor's office and usually takes just a few minutes. Vision improvement is typically rapid, often within a day or two. After the procedure, eye drops are prescribed to prevent inflammation. While completely preventing PCO is challenging, certain strategies during cataract surgery can help reduce the risk. These include meticulous removal of lens epithelial cells during the procedure and the use of intraocular lenses designed with sharp posterior edges, which act as a barrier to cell migration. Newer surgical techniques and lens designs are continuously being developed to further minimize the incidence of PCO. The prognosis for PCO after wide laser capsulotomy is excellent. Most patients experience a significant and lasting improvement in their vision. The procedure is generally safe and effective. While it's rare, potential complications can include retinal detachment, increased intraocular pressure, or inflammation. Recent research is focused on developing more effective surgical techniques and intraocular lens designs to minimize PCO formation in the first place. Additionally, scientists are exploring pharmacological agents that could inhibit the migration and proliferation of lens epithelial cells. These advancements promise to further reduce the burden of PCO and improve long-term visual outcomes after cataract surgery.